Strokes are the leading cause of death in the United States. About 795,000 people in the United States have a stroke each year. Every 40 seconds, someone in the United States has a stroke, and every 4 minutes, someone dies of a stroke. Stroke risk increases with age, but they can occur at any age. Race and ethnicity can impact the chances of an individual getting a stroke, and it is nearly twice as high for Black people. Since 2013, there has been an increase in stroke death rates for people who are Hispanics. High blood pressure, high cholesterol, smoking, obesity, and diabetes are leading causes of strokes. The characteristics of a stroke. What is a stroke? A stroke is when something blocks blood supply to a part of the brain or when a blood vessel in the blood bursts. Both of this will occur and cause damage to the brain, causing long-term disability or even death. To work properly, your brain needs oxygen. Although your brain makes up only 2% of your body weight, it uses 20% of the oxygen you breathe. Your arteries deliver oxygen-rich blood to all parts of your brain. When there is a blockage of blood flow to the brain cells will begin to die within minutes because they don't receive oxygen, causing a stroke to happen. There are two different types of strokes. An ischemic stroke occurs when blood clots or other particles block the blood vessels to the brain. Fatty deposits called plaque can also cause blockages by building up in the blood vessels. Hemorrhagic stroke occur when a blood vessel bursts in the brain, blood builds up and damages surrounding brain tissue. Signs and symptoms will arise when an individual has a stroke, such as sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking, or difficulty understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, or a lack of coordination, severe headache with no known cause as well as another symptom. FAST. FAST is an acronym used as a mnemonic to help detect and enhance responsiveness to the needs of a person having a stroke. The acronym stands for facial drooping, arm weakness, speech difficulties, and time to call emergency services. Here's how you can try the simple test to help if someone is having a stroke. F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Ask the person to raise both arms. Does one arm drift downward? S stands for speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T stands for time. If you see any of these signs, call 911 right away. It is very important to note the time when any symptoms first appear. This information helps healthcare providers determine the best treatment for each person. Do not drive to the hospital or let someone else drive you. Call an ambulance so the medical personnel can begin life-saving treatment on the way to the emergency room. The societal impact a stroke can have: emotional and psychological. Role changes may occur as sometimes a stroke may leave a stroke patient confused or lethargic, and the impact it can have on a family is crucial. Families may feel a sense of helplessness, grief, anger, guilt, and even depression as they have to come to terms with the new reality they are facing. A stroke may also affect finances, as this person may have been the bread maker and now will cause stress to not paying bills, but also medical bills that will come from treatment. The financial burden a stroke can have for someone in the United States can come to nearly $46 billion, which includes the cost of healthcare services, medicines to treat stroke, and missed days of work.
Hello, this is my explanation for the mechanism diagram. So in total, it's possible to have 3 different types of strokes to occur: ischemic stroke, hemorrhagic stroke, and transient ischemic attack, or a mini stroke. An ischemic stroke happens around 85% of the time and is usually separated into 2 different categories, either thrombotic stroke or embolic stroke. Both these strokes have the same end result. However, when the clot itself is formed differently. When having a thrombotic stroke, the clot develops in the brain, blocking the arteries or vessels, therefore obstructing blood circulation to the brain. Since blood circulation is being obstructed, there is a lack of oxygen being delivered to the brain, and this could lead to necrosis and eventual cell death. A subcategory of thrombotic strokes include a transient ischemic attack, which in a sense is a mini stroke. Often cause for TIA is fatty deposit buildups in the artery, but only briefly cutting off oxygen to the brain, unlike an actual clot. TIA may not necessarily be dangerous per se, but it's extremely hard to distinguish whether you're having an actual stroke or just a mini episode. Either way, it's best to seek medical attention regardless. An embolic stroke is when a blood clot develops elsewhere in the body and the clot becomes lodged in an artery, which also impacts circulation. The clot is also not necessarily in the brain. This then follows the same path as the thrombotic stroke, which obstructs circulation, causing oxygen deprivation to the brain, and then eventually necrosis and cell death. The second type of stroke is hemorrhagic stroke, and is caused when the vessel in the brain is weakened and it ruptures. When ruptured, this causes a localized bleeding to occur, therefore causing a hematoma when blood accumulates in the area, also known as an intracranial hematoma. While the hematoma increases pressure in the brain, it causes the brain to swell, therefore restricting blood flow because of the swelling. Then it follows the same path of all strokes, since reduced blood flow causes oxygen deprivation, and then it causes necrosis or cell death, or eventual cell death. The symptoms of all stroke cases are all caused due to the lack of oxygen going to the brain, such as numbness, confusion, difficulty seeing, etc. Thank you.
There is a wide variety of treatments available for individuals that have suffered a stroke, but I'm going to be discussing the common forms of treatment. These are tissue plasminogen activator, which is TPA, osmotherapy, and of course, dialing 911. Believe it or not, 1 in 3 stroke patients never dial 911. Although this number may seem small, if we apply it to however many stroke cases there are per year, which is currently more than 795,000 people, according to the CDC, about 610,000 of these individuals are experiencing their first stroke, and about 185,000 are people who have suffered a previous stroke. If we put the number of patients that don't die on one into perspective, we're talking about 265,000 people annually. It's crucial that these patients do so because paramedics could provide life saving treatment and gather critical information on the patient's status and complications on the way over to the hospital. This would give the emergency room enough time to prepare for the patient's arrival and immediate operation afterwards. Patients who arrive within 3 hours of the first symptoms of an ischemic stroke receive a TPA. According to Jelani and Siddiqui, it gets rid of blood clots by accelerating the process of converting plasminogen to plasmin. The TPA itself, the TPA attaches itself to the fibrin of the plasminogen, which allows the plasmin to break off from the plasminogen. The plasmin then finishes up the job by breaking down fibrin molecules, leading to the dissolution of the blood clot at the affected area. Osmotherapy is used to treat increased intracranial pressure, or ICP, which is a byproduct of a stroke. This method utilizes hyperosmolar therapy to extract water to reduce the volume of the brain. Mannitol is the agent that helps the body lose water through osmosis since the concentration of the kidney filtrates increases. In doing so, the reabsorption of water is blocked, creating more space for the cerebral spinal fluids to flow and as a result, lowering the overall ICP. Now I'll be breaking down the risk factors of a stroke into two categories, one being controllable and the other being uncontrollable. First off, the controllable risk factors include mental health problems and overall lifestyle. Anxiety and stress release hormones into the bloodstream, which result in increased heart rate and blood pressure due to vasoconstriction. This would increase an individual's chances of developing a stroke since a blood clot is more likely to form at the heart or brain. The National Heart, Lung, and Blood Institute suggests only working within the normal full time hours while keeping in touch with family members and friends. People tend to keep their problems to themselves and don't want to reach out to others for help, which leads to these mental health problems that could negatively impact overall health. Adopting a healthy lifestyle is something that's completely within our grasp. However, it really depends on whether you want to make the shift and if you can keep up with it. This doesn't mean you should limit the amount of you should limit the amount or completely cut out the unnecessary urges in life such as drinking, smoking, and even sleeping too much. The chart provided under the lifestyle section displays the findings from Bohemian. They figured out that a diabetic person taking hypertension medication almost had a 20% chance of developing a stroke, but incorporate smoking into the equation and their likelihood doubles. This brings me to the next portion, which are the uncontrollable risk factors. Genetics are something we don't have the power to control since it's something we're born with. Therefore, an individual that was born with diabetes and hypertension that required medication would already have a 20% chance of developing a stroke. I've already mentioned how smoking significantly impacts those chances, so it's best that they shy away from it. Gender also plays a role in the risk of having a stroke since it's proven that men are more likely to have a stroke compared to women, but then we also have to account for age because women have a longer life expectancy than men. Therefore, their lifetime risk is definitely higher, but hormone altering medications and pregnancy increase their rates even more. Now you might be wondering why the location of residency is in the middle. Well, that's because it really depends on the family. Some families have more financial assets than others, which means they'll be able to relocate more easily. This could alleviate the air pollution and accessibility to healthcare issues. According to Lee and their colleagues, controlled and experimental studies they noticed that air pollution is correlated to the induction of endothelial dysfunction, which narrows the arteries on the heart. Atherosclerosis builds up, which builds up plaque that could block blood flow, and the coagulation has the potential to change blood into a more solid form, which is essentially the start of a blood clot.